very proud people, very hardworking, very intelligent people and so forth. And like many of the reservations are underprivileged, underserved. And that's where we are serving our best work, is by bringing specialists and nursing personnel, pharmacists, volunteer workers, skilled workers, electricians, carpenters, etc., to help meet some of their needs out here.
This is really why we got into healthcare in the first place, to take care of people where there's such a need. And again, it's so, I can't describe how rewarding and fulfilling it is to take care of these good people who are so very appreciative, and be able to hopefully positively impact their lives in this way. And I'm sure everybody who goes out has their own motivation, whether it's humanitarianism or whether it's to try and do unto the least of my brethren as you would do unto me. But whatever the motivation, I think everybody comes away with the same tremendous feeling of fulfillment.
I volunteer with the group and I work in the pharmacy. We traditionally come during Indian days, so the volume is fantastic because we have a number of doctors that come with us, and they do procedures and surgeries that they don't ordinarily do at the hospital here, and see a lot more patients. During Indian days, all the Indians from the reservation come to this powwow. And they see these doctors and the doctors that are here, and of course that generates an awful lot of prescriptions for the pharmacy. In fact, last Monday, I believe we did just under 1,000 prescriptions, so it's just a fantastic volume. And the people here, especially in the pharmacy, are very appreciative of us coming.
Being from close to a big city, we have access to a lot of advanced medical equipment, which they don't have access here. So when we come to this area, they're excited to see what we can bring and show them new that will help the doctors here better diagnose the patients and help with a better plan of treatment for them.
Dr. Matheu's group is able to make an impact due to the fact that we can organize and we can schedule and we can bring patients in, and throughout the year, knowing that they're going to be here in mid-July as they normally come, that we schedule those patients who could benefit from the services that they deliver. And they bring a variety of many services. They've helped us with the pain clinic. They've talked about nerve conduction studies, things that would help us in order to better serve our patients.
Part of the agreement in coming out here is we try to get everyone to give a talk to the staff here, which they enjoy quite a bit, on our area of expertise. So yesterday I spoke about HPV vaccine, that is the new vaccine for cervical cancer, and I also spoke about autism. These are things that pediatricians from our big urban areas have to deal with every day, and tried to go over with them what our opinions were of the new immunizations and how we were implementing those. You're better off not to lecture, but more to kind of dialogue and find out how they're dealing with the new issues and how we're dealing with the new issues, and then we can kind of learn from each other.
I do this because I think it's my responsibility as a physician to care for people, and it's a situation where I can take care of people who are not being served. In my practice in Chicago, I see a number of people who can't pay, and I do that because I feel it's my responsibility. But here's an extra whole week of my life once a year that I can give where there's no compensation, and I'm able to take care of people.
The Native American population has a lot of diabetes. The incidence is quite high. So as a result, the incidence of diabetic retinopathy is high, so that needs expert ophthalmic attention. The incidence of glaucoma is quite high in this population, especially an unusual kind of glaucoma called low-tension glaucoma, which is difficult to diagnose. So there is a lot of eye disease which needs care. to have the attention of a specialist, and especially when they know you're a volunteer specialist, they're very happy about that. So I think it's a good feeling both ways. I get a lot of good feeling doing it, and they feel good about having it. The optometrists definitely appreciate my presence, seems to me. So, you know, it's just a great feeling to give, and not to have to worry about coding, paperwork, fee schedules, or anything like that. I just take care of patients, and that's it. And that's the wonderful thing about it.
I got involved with the group through Dr. Matheu, who I work for in Chicago, and he started out coming up just to give back a little bit of his time, and was very excited about working here, and decided he'd like to recruit some people to come down and have the same experience he did with helping out. So that's how it started, and came down the first time, and been 6 years coming back. So we enjoy it. We come with a very nice group of people and have a great time, and patients are very kind. Staff is great. It's been a really good experience.
It's really important to our community. If we didn't have a hospital, where would we go? We have no place to go. And most of these people here, the people here don't have no insurance, health insurance. So the only place they got is this hospital. That's why it's very important for us to keep this hospital open, keep it running.
Those particular individuals really benefited to no end because they had knees replaced, they had shoulders replaced. These are types of things that otherwise they would never have them done. And the way modern medicine is that if things are cost prohibitive, they give them a pill. It might be a pain pill, might be a pill of some type, but the actual procedure that our people need doesn't happen. So they have to go without. So that's the benefit we have from folks like Dr. Matheu and his group coming in here to take care of these Blackfeet people.
About 3 years into starting the program, one of my patients had commented they would love to join and go out there with us, but they were non-medical in training. And I realized there were certain things that needed to be done out here that were sometimes very hard to achieve, whether it's building a wheelchair ramp, building a porch, some home remodeling. And I thought, why not incorporate skilled labor? Why limit everything just to medical? So I brought teachers out here, I brought electricians, carpenters, anybody who wants to give. And the work crew is very busy and very successful in what they do.
I was asked originally by Dr. Matheu, who is a good family friend, he's also my physician, to come out to Browning to help with his medical crew and actually to do the construction work for the volunteer group. I feel we're doing some good. We're doing a lot of good, and it's important to me. And I'll be back next year and the year after that too.
I think maybe I've come at it from a different angle. I think that it's a difficult life, and we see through this work and our exposure to Browning and so on. It's a difficult cultural thing to be living on a reservation, and they seem to be afraid to leave the reservation. Yet on the reservation, there's not a lot of jobs, so there's naturally get into a lot of difficulties with drug and alcohol. But I think a lot of the people here seem to be trying to pull together and try to get themselves on the right path. And
it's definitely opened up my eyes to, I guess, the poverty around here and the unemployment rates and stuff like that, which is something you don't really think about in your daily life. And I guess kind of to witness it firsthand is definitely an eye-opener.
It was very sad. We saw an awful lot of families, technically the people of working age, sitting at home during the day versus working. You'd find beer cans strewn across the yards. You'd see houses not being taken care of. You see family members not really engaged in the community. And Since that time, we're seeing more and more progress being made in Browning and across the area.
Just the group itself has evolved by working with the Blackfeet people and learning about their culture. But the little things we've learned, like Glacier Park, is on the Blackfeet Reservation. I mean, it's a national park, but it sits on Blackfeet Nation land. So there's a culture and history out here that you just have to come out and experience.
There's a lot of worthwhile work to do here, that there are people who need the help, that the people we've been helping are the elderly, the infirm, the people who can't do it for themselves. And it's the same with the medical mission, that they're working with people who haven't been able to be serviced by the Indian Health Service. And the other thing is that there are issues between the tribe and the Indian Health Service that are kind of political issues. So the mission serves a purpose not only on the medical side, but on the remodeling/renovation side. And we've been building a dorm here for the mission, so that Brother Paul will have some place to bring kids and work with them on the site.
I think we both feel that we've received a lot of blessings in our lives, that we have a very nice lifestyle. It's comfortable. We live in a nice little town, a college town now, and you know, we've taken a lot, but now it's time to give back, and I think that's a big part of it, is to be able to give back to people who mean something to us. And Father Ed, the church, Brother Paul, Brother Ray, they're all very important people to us. It's a big sacrifice for people to live out here, who are, it's not an easy environment. Sister Edna, she's been here for 25 years, and they devote a lot of their life to this area and to these people, and it's just a small thing that we can do to give back.
Well, I think they'll experience the personal satisfaction of giving their time and talent. They'll be exposed to a culture that they've never been exposed to before, and learn something about a different group of people, the Blackfeet Nation.